Hi everyone, my name is Sherlou Himbing. I'm a nurse and I recently got my bachelor's of nursing. I work at the UCSF Cancer Center as a float practice clinical nurse. What motivated me to pursue a career in medicine is I was really attractive to the fact that there were so many options. And nursing during that time, I figured I can get my associates and then start working and actually, make money, and then maybe use that as a leverage so that I can have funds to get my bachelor's. I also like the fact that you don't have to stay in one career path. As a nurse, you have a multitude of options. When I decided to go to nursing, because there was this 2-year program that I could take and start, making money and start work and support myself. The associate's degree, they teach you the clinical part mostly of the nursing program. So that's when you learn your techniques, how to start IVs, learn how to take care of people. And once you pass that, then you can proceed to your bachelor's, which is mostly, I would say, theoretical work. That's when you learn a lot of the background of the nursing history, and you're looking at more of, theory and practice, leadership, that kind of thing. For me, getting my bachelor's was more I've always wanted to get my bachelor's, but I also considered the cost. So I was actually paying out of pocket for each semester because I was trying not to, amass more loans. And that's why it took me a while, which I would really recommend to anyone going to nursing school, is that you go to, especially if it's not like a bachelor's, if it's your core nursing, you want to go to a school that has a hospital that's affiliated with it, because typically the training that they have, they're going to primarily utilize that hospital, which will then help you get a job after graduating. Some of my colleagues, they said it took them like 2 to 3 years to complete their associates, plus another 2 years from the bachelor's. But because I've already gone to a different, I've already taken bachelor credits, it only took me about a year to finish my bachelor's this time, and it took me about a year and a half to 2 years for my associates. People usually finance their training several ways. So you can take out loans, you can work part-time and go to school. The way most, people, what most of my classmates did was they had some type of job while they were going to school. The way I did it was I got my CNA license. I started working in the hospital, and I worked at night. I was a night shift CNA, and then went to school during the daytime, and then took out loans, and lived very frugally. I highly discourage you from going to nursing school and just taking out loans and just spending on anything. If you have to take loans and only use it for the most important things. I think during nursing school, not having that financial cushion and not having, help as like some people would have, was very difficult for me, because I had to basically support myself. So that was really hard, I think. But, for me, I always tried to focus on the end goal and, what needs to happen, because I also had goals on why I was going to nursing school, like help my family, have more financial resources. So there wasn't really an option for me to fail. It was like, you either pass or you pass. There's no in between. So that was kind of, the mindset that I had. I didn't know what I wanted to be. And so I just pushed my application and checked off, different units that I wanted. I did want to be a trauma nurse because I wanted, my goal was, when I became a nurse, was to be a flight nurse. So you have to be a trauma nurse or an ICU nurse before you can be a flight nurse. And so I checked off the burn unit at the closest hospital, but oncology called me. And so I didn't know, I know about cancer and I know about oncology. But for me, it was like, I got a job interview, my graduate nurse little self, like, go over there. And so I had an interview and they offered me a job an hour after my interview. And so that's when I became an oncology nurse, and I am still an oncology nurse. What I would say is the most rewarding to me is just being there with patients. I think my patients that I've had the honor to work with, they've taught me a lot. I think growing as a person because of my patients is the thing that I love about nursing the most. Because you get to be there at their most intimate moments. I've been with patients and talked to them about things their family didn't even know about, the struggles that they have. And I think to be there for someone, and I don't like to say that I give to the patients. I think they give to me more than I give to them, to be quite honest. Like, that's how I really feel. I think for challenges, I think making sure that you're providing the best care, with whatever you're given, with the situations you're giving at work. I think those are the biggest challenges, which is why I'm very thankful I worked at UCSF, because we have, like I said earlier, we have a great leadership team. Not only that, our leadership team understands our roles and the patient's role, and so the decisions that they make reflect on how the processes and how our protocols become when we take care of patients. Because for me, I have left institutions because I felt like they didn't understand what the patients need, that they were just there for the money, that they weren't giving us the tools that we needed to take care of patients. That's the biggest challenge for me as a nurse, because once I feel that I can't do my job and offer the best that I can to the patients that I'm taking care of, to the people I'm taking care of, that's basically it for me. What surprised me about my field the most was that I loved it. I was really shocked. I mean, as someone that went to nursing, like, hey, I could, do a 2-year and like start working, make some money, and then love it. Like, that was surprising, and how much I've grown from it, and how alive it helps me like feel. And especially now that I work at UCSF, not only do I feel like I'm doing a good job taking care of people, but professionally, my professional growth, I've had so many opportunities to grow here. Keep your eyes on the goal. Don't ever stop growing. Take every opportunity you can to grow. Don't just stop at, oh, I have a great career, I could stay here. Think of things, how can I grow as a person, as a nurse? There's going to be many people who will disappoint you, but always remember why you became a nurse in the first place. And even if you didn't have a goal when you first started, make one and keep your eyes on it. Always keep your eyes on the prize. Once you reach it, make another one, and just continue to grow. And you'd be surprised, and be open. Be very open, even if it's hard.